All right, hello everyone. My name is Dr. Joel Rosen, and I'm here with a patient of mine, Victoria, and she has given me permission to ask her a couple questions on what she's experienced so far as a patient of my practice. Victoria, can you tell everyone how you first? Oh, and she also, I'm very happy that she's doing this for me because she doesn't feel like her English is the best, but I think it's very good, so she will still talk with me. Can you tell me how you first found out about my office?
I found out about Dr. Ross's office on Facebook page. I was looking for a doctor. I because I was very tired to go to the doctors, like the normal doctors, and all what they say. I took a test and they say is everything okay. So I heard like some about adrenal fatigue and and I found him on Facebook
Right, right,
page.
exactly. And then you came to a workshop and we explained about what we do in the office. And then we decided to go through a visit of how I will work with someone in the office. And at that time, we went over some blood tests, we went over some examinations, and I explained to you how the program works, correct? And
Correct.
yeah, and that's when you started with
Yes.
me. So now we are here probably about 6 weeks later, and you've been having some really good news. So tell us about, well, first, what you were dealing with. You were fatigued when you first started. Was there anything else you were feeling before you started?
Yes, I was feeling very dizzy. I didn't have desire to do anything. I just want to go home and stay in the bed sleeping. I didn't have any focus. Um, so I started, I think six weeks ago, I started to do a diet and to take supplements. And today I am with Dr. Rosen and I'm feeling very, very, very well.
Right, you were telling me, and I'm really happy to hear that. You were telling me about the other day where you had a lot of energy and you did one thing after the next and after the next. And I guess it'd been a long time since you did that, something like that, where you hadn't had that energy to do what you were doing.
Yes, for a long, long, long time I haven't been feeling this way.
Are you happy with the
Oh
program?
yes, very happy.
Yeah,
I
yeah.
recommend anyone, all my friends, because they complain, oh I'm tired, I'm this, I'm that. So I say, oh I'm going to a doctor, and so if you need help, I can.
You would tell them to go.
Yes.
You know, one thing that I mentioned to you also is that it's not so much me and me helping you. All my successful patients are the ones that they follow the recommendations. So you had to, for your protocol, you had to avoid certain foods because your blood sugar fell very, very much. That was putting a lot of stress on your adrenal glands. We didn't necessarily have to change the foods per se, what you were eating, but we had to make sure that you weren't waiting for too long between each meal. And a lot of the times you were waking up, 3 o'clock, 4 o'clock, 5 o'clock in the morning. So we did a couple tricks to make sure that you wouldn't wake up and you would stay asleep throughout the whole night. Could you say, was it difficult to follow that plan? Was it hard? Because a lot of people may be skeptical, oh, like she can do it, but I can't do it. What would you say? Was it very difficult to do that?
No, it's very. You need to be um, determined. In the beginning, in the first week was very hard. When I remember when you said you have to change like the breakfast, and I was thinking, how?
What are you going to eat?
Yeah,
Yeah,
we're gonna eat. I was thinking to eat food in the morning. I never did that, right. So now I'm used to.
Right. Now it's
So
part of your habits.
yes,
Perfect.
yes.
So if someone were skeptical and they weren't sure and they were watching this video and they weren't sure to come to me, what would you say to them?
Uh, I would say if you want to change your life, if you want to feel better, you have to invest.
Right.
This is what, when I came in here, was what I was thinking. This is like my last resort. I can do anything
Right.
to to feel better.
Right, right. And that's how we get a lot of patients. Well, thank you so much for
You're
sharing,
welcome.
and I appreciate
You're
that.
welcome.
Thank you.
You're welcome.